You're welcome to my channel. Today I'll be going through possible causes of bruises and bleeding. Briefly, by way of definition, bruises could be noticed by either on your own skin or the skin of somebody else as discoloration or patches that will either be black and blue or brownish and dark purple, but mostly due to damages to capillaries and leakage from the capillaries below the skin. Bleeding, on the other hand, either if you are in North America known as hemorrhage, or you are in Europe as this, the spelling is just a little bit different, but it's the same, is when blood is lost from the vascular system and it could be concealed, meaning hidden internally, like is found in intracranial hemorrhage, abdominal hematoma, thoracic hematoma, cardiac tamponade, or externally through a break in the skin, you see the blood flowing, right? Or through orifices, otherwise known as openings, like nose, then you have epistaxis, nosebleed, mouth hematemesis, hemoptysis, or through the anal region like hematochezia or melena, and so on. The vessels and bleeding types here means could be arterial in origin from the artery. In that case, it will be pulsating or gushing or spotting, and it will appear red, bright red, and this will be the most dangerous type, whether it is very difficult to stop or correct, particularly if it is coming from a very large artery. It is likely going to be from the veins, then it's referred to as venous bleeding, which will be oozing, slow or steady, and it will appear dark red. If it is from capillary, of course, the pattern of bleeding is still capillaries, right? At onset might be a bit fast, but later on become very slow or trickle, and might be bright or dark red. Other features to briefly consider before going through the list would be bleeding could be bruises like being described, or frank blood, or you can see clots, or your stool is black and tarry color. Hemoptysis, that is the phlegm or sputum, is blood stained, or even sometimes people cover blood in large quantity, or hematemesis when you vomit blood, or hematochezia when there is frank blood from the inner region, ecchymosis or epistaxis when you are oozing blood from the nostrils, petechial patches, intracranial hemorrhage that is concealed bleeding inside the brain, or subarachnoid hemorrhage between the brain and the coverings of the brain, abdominal hematoma within the abdomen, thoracic hematoma, cardiac tamponade, and so on and so forth. The list is pretty long. What are the risk factors? So now, when someone is presenting with bruises, or you have bruises, or your friend has bruises, or frank bleeding, then ask the following questions. Are we dealing with abuse here? If this is found in a child, could this be child abuse? Maybe now caregiver like elder abuse. It's possible. Somebody has pushed somebody down somewhere, or hit the other person with something somewhere, or intimate partner violence, treatment at home, or spousal abuse. So first thing first, The legal aspect of it is to rule out abuse. Then other factors would then come into play, like trauma, which could be minor or major, self-inflicted, or abuse or torture or molestation. Could be iron deficiency anemia. Now, this is a bit funny, right? Massive blood loss could lead to iron deficiency, or slow blood loss internally, like someone that is having internal bleeding. For example, someone with colorectal carcinoma, with melanoma too, or upper GI bleeding that is not being controlled. With time, he or she will come down with iron deficiency anemia. But iron deficiency on its own can actually lead to bruises because decreased iron will lead to more skin bruising. Poor diet, liver disease. Liver disease because a hepatocyte of the liver is responsible for many of the clotting factors except two. And the two that will not be produced by the liver hepatocytes will be von Willebrand factor and factor 8. And also and when there's problem with the liver, then there'll be bleeding problem. Thrombocytopenia is low level of platelets. Other causes could be renal failure. When there's renal failure with hyperuricemia, there might be bleeding. Long-term dialysis can lead to bleeding. Overwhelming sepsis can lead to bleeding and shock, particularly DIC, disseminated intravascular coagulopathy. Rigorous exertion can lead to microscopic tears, and some bruises could be found. Alcohol abuse, because that could lead to, vomiting, hematemesis, like that. Still on risk factors, aging, particularly in elderly, but be sure that is not adult abuse before just thinking it's aging, okay? Von Willebrand factor disease will lead to massive bleeding, particularly in women during childbirth, and anyone with von Willebrand factor disease having surgery. So, hypofibrogenemia and vitamin C deficiency. Still on risk factors, people with hemophilia A or hemophilia B will have problem with bleeding, disseminated intravascular coagulopathy, and anyone on medications like anticoagulants, non-steroidal anti-inflammatory drugs, or antiplatelets. Don't worry, I'll go into the list of more medications in a bit. Anyone having all this, we have to have clotting profile done, then even liver function test done, and so on. And besides that, we'll have to check physically, looking for petechiae, ecchymosis, epistasis, and so on. Any future bruises that will show that the individual is bleeding. Retained products of conception in women. When therapeutic or self-chosen or whatever abortion is done and part of the product is retained, or there's spontaneous abortion but not the exact part is out, or inevitable abortion or missed abortion, and product of conception is retained, that will mop up clotting factors, and then there will be bleeding after. Thrombolytic agent, that is why we need to rule out who should be capable of taking thrombolytic agents or not in the face of stroke, pulmonary embolism, and so on. vitamin E deficiency, high blood pressure. I've seen a guy with a very high blood pressure who came down with epistaxis. He presented at the emergency room because of epistaxis that was troubling to him. But taking the vital signs, the BP was up there. Cancer like leukemia. Other risk factors would be pressure effect on the skin that is causing bruising. Garlic. Garlic will interfere with vitamin K metabolism, and there are certain clotting factors that are vitamin K dependent, like clotting factors 2, 7, 9, and 10. So, too much garlic over time will interfere with those factors and there might be bleeding. Fish oil. Large amount of fish oil can inhibit blood clotting. Other factors that might lead to bleeding will be liver problem, like liver cirrhosis or liver failure, for reasons already stated earlier that many of the clotting factors are actually synthesized by the liver in the liver cells known as hepatocytes, except two. And those two will be von Willebrand factor and factor VIII. And some people will still have problem with von Willebrand factor, having von Willebrand factor disease, and even with factor VIII, having hemophilia. SSRIs, selective serotonin reuptake inhibitor, they will cause problem leading to bruises or bleeding because SSRI will interfere with platelet function. Glucocorticoids will interfere with vascular integrity, so there can be bruises or bleeding. Some antibiotics, particularly fluoroquinolone, can lead to aortic aneurysm in at-risk people. So that warning was given sometimes in the past by United States Food and Drug Administration, US FDA, specifically in December 2018, that anyone taking fluoroquinolone should be aware they could have bruises and bleeding. And with that, I've come to the end of the brief list I could supply when it comes to bruises and bleeding. So anyone who is bleeding and having bruises, go through this list, find out why you are, and make sure you get treatment. Thanks for listening. Remember to share. Remember to subscribe to my channel. I appreciate it.